In 2016, 50,000 Americans died due to drug overdose. To combat this epidemic, the Centers for Disease Control have implemented new, strict requirements for the documentation of the patient's mental health status before, during, and after treatment. Providers must document the reason for prescribing pain medications, the patient's risk of medication misuse, and potential side effects on the patient's physical and mental condition. The CDC also requires that these records be updated every 3 months. Failure to clearly document the mental and physical baseline during evaluation and the treatment phase can put the provider's license at risk. To fulfill these new requirements, the CDC suggests that clinicians should use validated instruments to assess each patient and ensure safe treatment for their condition to be optimized. ThoughtSwift's Pain Management Electronic Health Assessment, or Pain EHA, assists providers to comply with the requirements mandated by CDC while dramatically increasing the revenue of the practice. Our patient-generated, evidence-based electronic screens are specifically designed for pain prescribing physicians. The Pain EHA takes 6 minutes, delivered on an iPad in the exam or waiting room. The diagnostic results are instantly delivered to a HIPAA-secure email and downloaded onto the patient's record. ThoughtSwift's Pain EHA delivers pain-specific results included but not limited to somatic severity, disability level, daily activity level, nature and intensity of pain, effect of pain from physical and psychological aspects, and benchmarks for evaluating pain improvement. Mental state of the patient including depression, anxiety, history of mental illness. Drug and alcohol usage by uncovering the patient's family history of abuse, their personal alcohol consumption, recreational drugs such as marijuana, opiate, and nicotine products. And lastly, the Pain EHA uncovers coexisting and underlying conditions that a patient may have, such as obesity, lack of sleep, breathing issues, headaches, and suicidal ideation. Beyond the clinical value, ThoughtSwift's Pain EHA increases practice revenue. Your practice will assess several new billable codes that are payable by Medicare and commercial payers. Providers increase patient revenue by $50 to $125 above the exam fee and other services. Because screenings must be done every 3 months, the Pain EHA increases practice income of well over $100,000 or more annually without adding staff or large capital outlays. Practices that use ThoughtSwift Pain EHA easily document the CDC mandates, improve patient care, increase macro benchmarks, and dramatically raise practice revenue. To find out more how ThoughtSwift can help your practice, please contact your local ThoughtSwift representative.